Welcome to our channel, where we dive into the exciting world of NCLEX-RN case studies and nursing management questions and answers. In this series, we will be covering some of the most important topics in nursing, including burn management, different approaches to nursing care, the emergency triad, gout, osteoarthritis, and rheumatoid arthritis. At any point you find yourself feeling confused or unsure, I invite you to take advantage of our free NCLEX-RN Fast Track practice course. The link to this course is available in the description below, and you'll be well on your way to successfully passing the NCLEX-RN exam. So, be sure to like, share, and subscribe to our channel, and let's get started. A patient in emergency with second-degree burn is prescribed with topical application of silver sulfatazine. Which of the following regarding use of silver sulfatazine is not correct? Your options are: 1. The drug has a broad-spectrum activity against all gram-positive and gram-negative bacteria. 2. C for any symptoms of metabolic acidosis. 3. Discoloration of skin is common. 4. It doesn't cause skin irritation. The correct answer for this question is option No, 2 or C for any symptoms of metabolic acidosis. This option is wrong. You have to remember that the other main drug used in burn management causes metabolic acidosis. Silver sulfatazine doesn't cause acidosis as it is not a carbonic anhydrase inhibitor. An emergency department nurse has to prioritize among different clients rushing into an emergency department due to a bus accident. Which of the following cases should you prioritize first if there is a serious lack of nurses in the facility? Client with amputated left leg. Client with open fracture of right ulnar bone. Client with laceration of the palm. Client with close fracture of the tibia. The question is about the first priority, so there must be only one answer. According to the emergency department triage, the patients who have life-threatening situation and need immediate attention are placed in emergent priority or highest priority care. So the correct answer for this question is option number 1 or client with an amputated leg. If he or she is not treated, the patient may go under heavy blood loss and shock. Similarly, patients with open fracture come under second priority or urgent priority, and patient with laceration of the palm and close fracture falls in third or non-urgent priority. Example: a client is prescribed with Allopurinol and the nurse is giving instructions for the drug usage to the patient. The patient is also taking hypoglycemics. Which of the following instructions should she give to the patient? Your options are: 1. Report if any visual changes. 2. Take citrus fruits as natural supplements. 3. Regularly check the sugar level. 4. Do not take with blood thinners. I will give you some time to think for the answer. Okay, let me reveal the answer to you. The correct answer to this question is option 1, 3, and 4. This is a multiple options question, so there could be more than one answers. You can guess that it is a multiple options question as you are asked to select the correct instructions. Option 1 is right as there is chance of visual changes with allopurinol. Option 3 is also right as allopurinol may increase the sugar level of hypoglycemics and the patient is diabetic. Option 4 is also correct because it can increase the blood level of blood thinners. Option 2 is not correct. We should never use any sources containing too much vitamin C because this can aggravate the formation of kidney stones. Let's take an example. A 7 to 6-year-old lady with osteoarthritis is admitted with complaints of inflammation and severe joint pain in the knees. She is given corticosteroid injection for reducing the pain. Which of the following interventions could be accepted as a nursing management approach of this condition? Your options are: put her in splint or brace in knees, take out any large pillows from under her knees and heads, apply cold pads in knees, ask her to do light exercises to flex her knees. I will give you some time to choose the answer. The correct answer for this question are 1, 2, and 3. 4 is not correct as the knees are inflamed and there is acute pain. Light exercise, of course, is necessary, but this time she should be kept in splint or brace, and any movement should be avoided until the inflammation eases. I hope you got that answer right. Let's take an example. A nurse is accessing a client with deformed hands with complaints of pains and joint stiffness in the morning. Upon investigation of blood profile, it was confirmed that the patient suffered from rheumatoid arthritis. Which of the following advice would the nurse give the client? 1. Avoid any exercises. 2. Avoid stress. 3. Take NSAIDs only after meals. 4. Make the patient feel better for their body image. I will give you some time to think about the answer. Well, let me reveal the answer. This is a multiple option question. Remember, you are asked about advice, so there could be multiple advices. Option 1 is not correct. The patient must be asked to conserve energy and take care of their joints by avoiding heavy works, but light exercise can help to ease the joint movement and reduce the stiffness. Option 2 is correct. Option 3 is also correct. Taking NSAIDs such as ibuprofen in empty stomach can upset the stomach. Option 4 is also correct. Basically, rheumatoid arthritis progress as inflammation, formation of pannus, and then deformation of the bones as the bones start fusing together. This causes deformed hands and feet joints, so patient may be feeling bad about his or her physical outlooks. A mental hospital department for treating client with anxiety with a therapy group in which all team members are working towards making improvements in changing to a positive behavioral goal. What kind of care therapy is this? Your options are 1. Milieu therapy, 2. Cognitive therapy, 3. Modeling type behavior therapy, 4. Interpersonal therapy. I will give you some time to think for the answer. This is a multiple choice question in which one answer is correct. So how do you eliminate the most possible incorrect answer? The situation clearly shows no one is trying to model anything, or the client is not helped to model some good skill to change the behavior, so this option is obviously incorrect. Cognitive therapy uses changing the thinking of the clients to change what they feel and hence change their behavior, so this option too is wrong. In interpersonal therapy, a strong therapeutic relationship is developed between therapist and client, making them safe to express their feeling and feel support. So the correct answer is milieu therapy. Milieu means a safe physical and social environment and a group contribution for bringing desired treatment output. Here in this question too, there is group focus in making some positive behavioral change. So this is a correct option. I hope you got this right.